All right, I'm now going to be showing you guys the glute med to min tissue work. All we're going to be doing is kind of targeting the lateral portion of the hip and the glute, kind of in this section of the body. This is usually an extremely tender area for guys, but it's extremely crucial when it comes to mobility in terms of throwing. You know, whether we need to be externally or internally rotating, it's really important that we have a large range of motion and kind of ease of access to that range of motion in the hip. So this is a really good way to start addressing that. All you're going to need for this is a lacrosse ball, tennis ball, anything that's kind of circular we can use to kind of oscillate on is what we're going to want. Good rule of thumb with all of this tissue work, the larger the object, the less pressure there's going to be on the spot, so it won't hurt as much. And then the softer the object as well, shouldn't hurt as much either. So, you know, if you're extremely tender, maybe starting off with a tennis ball or something a little bit more squishy is going to be ideal, and then gradually working our way up. As you progress, you know, if you get to extremely advanced portion, maybe something like a golf ball will be a little bit better just because there's a smaller surface area, so there's going to be more pressure in the spot, but it also is extremely hard. So now to demonstrate the movement, all we're going to do is get on our butt. Again, we're going to use the lacrosse ball to kind of target this lateral portion of the hip. So I like to put it on the ground, kind of find that spot. And then from there, all we're going to do is take our foot where the ball is on that side, and we're just going to cross it over on the opposite knee. All we're doing here is kind of lengthening out that muscle and kind of that part of the body. And then all we're trying to do is find where the tender area is. So I like to just kind of oscillate around. You should feel it very quickly flare up and know where the tight spot is. And once you find it, so like right here, that's where mine is, just focus on that. So all we're doing is just oscillating in that one spot and just kind of staying there until the tenderness starts to kind of die down a little bit. And you'll notice, it'll light up at first and it'll become a lot easier to kind of just sit there. I like to spend somewhere between, you know, a minute to 2 minutes just focusing on that side. But again, good rule of thumb is just let the tenderness kind of die down, and all we're doing is just switching to the other side. But that is the glute med to min soft tissue work.